Ladies and gentlemen, thank you for standing by, and welcome to the COVID-19 media briefing conference call. At this time, all participants are on a listen-only mode. After the speaker's presentation, there will be a question-and-answer session. To ask a question during this session, you will need to press star then one on your telephone. Please be advised that today's conference is being recorded. If you require any further assistance, please press star then zero. I will now like to hand the conference over to your speaker for today. Mike Schumann, you may begin.
Thank you for joining us for the COVID-19 media call for August 19th. We'll start today's call with a situation report from Minnesota Commissioner of Health Jan Malcolm and State Epidemiologist and Medical Director Dr. Ruth Lynfield. We also have Infectious Disease Director Chris Erzman on the line with us. After their updates, we'll open it up for questions from reporters on the line. With that, I'll now turn it over to Commissioner Malcolm.
Thank you, Mike, and good afternoon, everyone. Across the world this morning, we're above 22.1 million cases of COVID-19 and 780,000 deaths. In the United States, we are now above 5.4 million cases and 171,000 deaths. We are announcing an additional 567 laboratory-confirmed cases of COVID-19 yesterday, bringing our new total to 66,618. That additional 567 cases is on a testing volume yesterday of just under 12,100. Our median age of cases remains unchanged at 36.0 years old. I'm very sorry to report today that we had 17 additional fatalities reported yesterday in Minnesota, bringing our total to 1,738 of our fellow Minnesotans who have died from COVID-19. 9 of the 17 deaths reported yesterday occurred among residents of long-term care facilities. Geographically, 4 of the deaths yesterday were in Nobles and Ramsey counties, 3 in Washington, 2 in Dakota, 1 each in Kennebec, McLeod, Olmsted, and Wright. This includes 6 persons in their 90s, 4 in their 80s, 6 in their 70s, and 1 in their 60s. This number of 17 deaths reported yesterday is the highest single-day death total since June 19th, which was also 17 deaths reported on that day. We have seen a few one-day spikes up above where we had been in the mid-single-digit range for quite a while. The 7-day average rate of growth in our cases is now at 6.9%, so 6.9% more cases this week than last week, compared to an 8.3% growth in the testing volume. So that continues to be a favorable ratio of more tests, higher test growth than case growth. On the hospitalization side, we also saw we're now 2 days of relatively high increases in the number of people in the hospital. Currently, 321 people are in the hospital, 17 more than the prior day, 152 of those in intensive care. So I think, as we have commented in the past, not unexpectedly, when we see case growth, we typically expect to see that followed by increases in hospitalizations and, unfortunately, deaths from COVID following later. I do want to mention one thing related to our testing data. Reported on the MDH website today, you will see a significant backlog of tests that have been loaded into our data system. A little more than 25,000 tests have been added into the system. The vast majority of those are negative test results that we have received from several labs. Specimen dates for this backlog go back as far as April. Now, this is the 3rd time that we've added a backlog of tests. The other dates were April 29th and June the 3rd. And this happens when we periodically bring new laboratories on board for electronically reporting results to us. And when we bring a new laboratory on board, we request that they report to us all available testing, including negative results since testing began for SARS-CoV-2, since that is important to have as complete a picture as we can of all the testing happening in the state. Certainly positive test results are the first priority when we get these new labs set up for reporting, so we ask for those to be sent in first, which means we sometimes do get a backlog, in this case a significant backlog of negative tests. Bear in mind that we have about 60 laboratories reporting into us electronically each day. And with that, I would like to turn it over to Dr. Lynfield for some comments.
Thank you very much, Commissioner. Last Friday, Infectious Disease Director Erzman talked about our LALO Before You Go advice for students heading to colleges and other higher education institutions this fall. We urged students to plan to avoid settings likely to have a higher risk of COVID transmission, such as crowded bars and house parties. And instead, please, we urge people stay at home and interact only in person with the people that you live with for at least 14 days before you return to campus. That advice was based on the recognition that even though college administrators are working extremely hard to make the return to school as safe as possible for students, faculty, and everyone else, the ultimate course of the outbreak on campuses will be determined in a large part by the individual decisions that students make in the time leading up to the start of school and then while school is in session. We've already seen some dramatic examples of what is at stake. Just in the last few days, we've heard about the University of North Carolina, Notre Dame, and Michigan State all needing to scale back in-person offerings due to COVID outbreaks on campus. Sadly, these outbreaks appear to be linked to social gatherings. In the case of Notre Dame, officials attributed a large share of the nearly 150 cases to off-campus gatherings where masks were not worn and social distancing was not practiced. We know many Minnesota students get this and are trying to do the right thing, but even a relatively small number of people ignoring protective recommendations can have a huge impact. If you don't believe us, just ask the students at Notre Dame, North Carolina, and Michigan State. Social gatherings are happening in Minnesota. We have heard and discussed with you about multiple parties in which there has been transmission of the virus. Please remember that people can be contagious for 2 days prior to symptom development. And some people don't develop symptoms but can still transmit the virus. We know people have an urge to socialize, but please remember your individual choices impact viral transmission in the community and impacts others. We're also hearing troubling reports of some parents who want to have in-person learning so badly that they are deciding not to get symptomatic children tested for COVID, thinking that if their child is confirmed to have COVID, it will impact the metrics that determine whether a school opens to in-person learning. Setting aside the obvious risk this creates for everyone else who would come into contact with their potentially COVID-positive children, these behaviors are exactly the wrong thing to do if we want to get the COVID pandemic in Minnesota under control to a point where more in-person learning is possible. We are hearing from colleagues elsewhere that children with mild symptoms are coming to school, resulting in transmission. Please keep your children home when they have symptoms. Some people who have been infected go on to develop symptoms for weeks to months. And some of these symptoms include fatigue, a racing heartbeat, shortness of breath, achy joints, foggy thinking, a persistent loss of sense of smell, and damage, in some cases, to the heart, lungs, kidneys, and brain. Studies are underway to learn more about this. So remember, COVID is not a totally benign infection. People ignoring protective recommendations are likely to prolong the outbreak, making it worse and making it more likely that we will all have to deal with a longer period of impacts on schools and other community institutions, businesses, and our economy. The way out of this mess is clear. Health officials and healthcare providers have their roles to play, and so does every single Minnesotan. Parents, students, business owners, workers, everyone. We need people to do the right things, and we need people to encourage their friends and their family also to do the right things. This means masking up when heading out in public, practicing social distancing, getting tested when appropriate, staying home both while you're waiting for the test result and when you're sick. Thank you. And I will now turn it back to Mike.
Thank you, Dr. Lynfield. Operator, we are ready to take questions.
Thank you. As a reminder, ladies and gentlemen, to ask the question, you will need to press star then 1 on your telephone. To withdraw your question, press the pound key. Again, that's star 1 to ask the question. Please stand by while we compile the Q&A roster. Our first question comes from the line of Catherine Richard with Minnesota Public. Your line is open.
Hi, I want to follow up on this question about going back to school. So for starters, as a reporter, we don't like to report on rumors, so I'm wondering if you could tell us more about these reports you are getting directly about parents not testing their kids on purpose. How many reports have you gotten? Where are they coming from? Are you seeing them in particular parts of the state? Are we talking about, school-age elementary kids or college-age kids?
Catherine, this is Ruth. So there are anecdotal reports that we hear about. I understand the position you're in. I think that the important message for the public is, please, if you or your children have symptoms, get tested. This is really important. We need to get our numbers down. We are all trying so hard. We all recognize how important school is. But if our levels of community transmission are high, we're going to have to shut down. And the important message is to be responsible in terms of your activities. We know it's hard. And also some people don't even know they're infected. So really it's important to be careful, to be socially distant, to wear masks, to wash your hands, all that stuff. But if someone has symptoms, please, please get tested. We want to be able to contact the people they've been in touch with. We want to be able to really damp down how much viral activity there is in the state.
So following up on that, given what you've seen at UNC and Notre Dame, are you changing your recommendations for colleges as they open? And I have a specific question about testing. We've gotten reports of some smaller private schools doing sort of regular required testing. Is that something the state would support doing widely? Among students and faculty, yeah.
Right. Okay. Thank you, Catherine. Our approach and CDC's approach as well is to really focus on testing symptomatic people or people who have a known exposure, or in certain settings, congregate settings, it may be important to do a point prevalence survey, such as in long-term care, such as in prisons. There are some additional situations where we are concerned about transmission of virus. As a general rule, though, we don't have an infinite supply of testing, and so we want to be sure that testing is done to those who really need it for a variety of reasons. There are some other reasons, people having certain surgical procedures, etc. And we don't want to end up in a position where we are having really long turnaround times because there's an issue with testing lots of people. We're not going to be able to test our way out of this pandemic. The important thing is to use prevention measures. You know, having a negative test doesn't mean you now have a green light to go and socialize and not to keep the distance. And we're very concerned about the kind of messages that, well, you can just keep testing and people can use their BC, before COVID behavior. It really, we have to work together on this, Catherine.
Okay, and just to be clear, no immediate changes you guys are suggesting to the, advice on college reopenings right now?
We are not. I think that there has been a lot of great work done at the universities and colleges, including consultation with the health department, and there's a lot of planning that's done. And we're going to, again, all the messages that people need to be responsible, they need to be careful. We don't want to lose the opportunity for people to have good educational experiences at the expense of some people partying. And so it really depends on what people do, whether the colleges what they'll be able to offer. And we will have to see how that plays out.
Okay, thank you.
Thanks.
Thank you. Our next question comes from the line of Paul Scott with Forum News Services. Your line is open.
Hi, another question about colleges. Do they have a mechanism to track cases on campus?
Chris or Ruth, do you want to take that one? I know that it's a good question of where and when different organizations are involved in case investigation and contact tracing, and when they're doing things themselves and when they're working with us or local public health.
Sure. This is Chris. I can take that. Yes. I mean, if a case is identified in a college setting or university setting, the Department of Health would work with both local public health, because in some cases local public health is the entity that is doing the case and contact tracing. So we would be working collaboratively with local public health as well as with the institution. And so our team would continue to do, meaning the public health team would continue to do the case investigation and contact tracing, but we do that in conjunction with the institution, because obviously they have more information on classes, on dormitories. They are also have been working to make sure that they have quarantine space available. So it really would be a joint effort, and many of our institutions of higher education have already started putting together teams. So I think the best way to describe it is a joint effort, because obviously public health would not be sort of abdicating, but by the same token, we would be working very closely in partnership with these institutions, because we need to do that in order to be successful with our response.
Okay, just to follow up, so you guys would make it parent to a given university that they have X number of students with COVID right now, is there a threshold when the school is required to make that number public?
We would be working with them on each individual case. So just to be clear, it wouldn't be a situation where we would all of a sudden say, well, you've got 7 cases now. We would be working with them in real time with each individual case. And we have been working collectively over the last number of months to identify, criteria when these institutions should modify their activities and, need to make changes. We have not, indicated a point at which they need to make that information public, but we have indicated that it's important that they're notifying students, parents, their community. That's kind of the focus.
So it's a guidance that you should keep your community notified, but ostensibly a college could have 100 cases and a student wouldn't know right now. Is that the case?
And a student wouldn't know?
Yeah.
No.
Yeah. Do you?
The instructions that we have are for how institution of higher education keeps their student body, their faculty, and their parents informed about what's happening on their campus. So, yes, we're working with them on all of that.
So they do have to tell the students how many people on campus have COVID. Is that what I'm hearing?
We're asking them to continue to provide updates within their community and their student body.
Okay, thank you.
That's our guidance to them.
Okay.
Thank you. Our next question comes from the line of Chris Series with Star Tribune. Your line is open.
Thank you. I just had a question about another question about testing. I understand that the state inspectors, the ones that go out to the long-term care facilities, are not being tested regularly for the virus, despite the fact that they're going into some facilities with known outbreaks. I just wondered why they're not being tested.
Jan, would you like me to?
Yeah, I would welcome you to comment, Chris. We actually, that's a conversation we've just been having recently, is what our approach should be to that. And in general, we do intend to begin testing our staff who are in those facilities.
And I was just going to add that we want to make sure that people are aware that these staff are wearing personal protective equipment when they enter the facilities, which provides protection to them, and that we have been reaching out to partners in other states to learn what they are doing as well. And this is an area that has not shown to have, definitive action. In other words, not all the states are doing one thing or another. So as the commissioner said, we're moving in this direction, but it's not something that has had consensus with our state partners.
Okay. As far as moving in this direction, do you know when you will start having the inspectors or surveyors tested?
We just have a little, Jan, we're, as I said, we just literally have been talking about this in the last day or so, so just have to work out kind of the frequency, the logistics. So it's not something that I can say we're ready to do tomorrow, but we're, as Chris said, this is a direction that we've decided to move in. So we're taking the next steps and planning that implementation right now.
Okay. And just briefly, why are you moving in that direction?
Well, I think it's consistent with the guidance that we've given to the facilities themselves about testing of residents and staff under certain circumstances. And as we have been talking so much about community transmission and the importance of being really mindful of who's coming and going into facilities, as well as just wanting to be sure that our staff have the protections that they need. And again, as Chris said, appropriate prevention behaviors, the correct wearing of personal protective equipment, and attention to all the prevention measures is a first line of defense. But we do think that testing of our staff would be consistent with the recommendations that we're making for others as well.
Okay, thanks.
Thank you. Our next question comes from the line of Darren Stevzon with Cato Radio. Your line is open.
Thank you very much. We're about 3 weeks into the governor's mask mandate. Have we reached a point where we can draw any conclusions on the effectiveness of the mandate yet?
This is Jan, and I'll certainly invite Chris and Ruth to comment as well. I think, as we've said before, it's always difficult to attribute specific causality to different interventions in terms of what percentage of impact might one thing or another have had. But as we've said before, we've certainly seen some what we kind of describe as stabilization in our case levels, albeit at a higher level than what we wish we were seeing. So that we think because rates have stabilized and trended down a little bit in terms of new case growth, as I mentioned earlier on, our rate of growth in cases is slower than it has been in the last few weeks, and certainly that's coincidental in time with the mask mandate. And based on just other published literature, other studies that have been done, we do believe that's certainly been a helpful component in what we're seeing now. But I would hesitate to try to quantify it precisely. But Chris or Ruth, any further comments?
None from me.
Yeah, I agree.
Okay, thank you.
Thank you. Our next question comes from the line of Jeremy Olson with Star Tribune. Your line is open.
Hi, with respect to today's number of deaths, and there had been 12 or so reported about a week ago. You've often talked about deaths lagging behind cases. Are these 2 days just individual blips, or are these signs of the lag that you had been concerned about with the higher case counts 2-3 weeks ago?
This is Jan. We probably need a few more days to see, because as you said, we have seen blips in the data over the last couple of weeks of a couple of days bouncing up into the double digits and then back down into the mid-single digit range. So we'll see if we start to see numbers in this range persisting for a while, then we would believe that it's likely part of that overall trend. Chris or Ruth?
Yeah, I'll just reiterate that when we have a day with really low numbers, we're pleased, but one day doesn't make a trend, and the same is true even when we have data that's a little bit more discouraging. One day doesn't make a trend, so we'll continue to watch these numbers.
A follow-up question, perhaps for Dr. Lynfield. At the end of her prepared comments, she listed the things we need to do, the things we need to do to fight this pandemic and to shorten its duration. But these are the same things that you've been saying since April, and I'm wondering if you've thought at all about how to fight measurement fatigue, or just mitigation fatigue is the term I meant. Kids are going back to school having heard this stuff all the time, and maybe they're kind of burned out from it. Is there a way to get people to kind of take this seriously after hearing it for weeks and weeks?
So this is Ruth, and I would say, Jeremy, one thing that would be useful is to remind people that some people do very poorly with this virus, and we are learning more and more about long-term effects, and that's why I included that piece, that some people go on and have heart damage, or they have other organ damage that is quite concerning. And sometimes they are people who were healthy prior to getting COVID. Sometimes there are people who had hypertension or diabetes and then really had a very, very prolonged illness. And we have seen younger people get into trouble with this virus. So I really think people need to respect the virus. And I think people should be alarmed at the amount of community transmission we now have. If you have the analogy of putting a frog in boiling water, the frog will jump out. But if you put the frog in the water and you start heating up the water, the frog will stay in even when the water gets really, really hot. And you said it, we have number fatigue, we have COVID fatigue, and I think all of us have to do whatever we can to remind people that this is important.
Thank you.
Thank you. As a reminder, ladies and gentlemen, that's star one to ask the question. Our next question comes from the line of Chris Rogers with Winona Post. Your line is open.
Thank you for taking my question. You've all, in a similar vein to the last question, you've all had some practice now at trying to get people of all ages to follow health guidelines. I was curious for college students and college campuses and off campus, if there are any strategies, whether it's public education, campaigns, or enforcement, or anything else that you think might be most effective at improving compliance with guidelines.
This is Chris, and I can at least comment that we've been working very closely with, as I said, our Office of Higher Education and colleges and universities across the state, both on messaging that they can use within their campus communities, messaging that suggests that, really it's the decisions that the students make that will enable them to continue to have, the learning on campus that they really want. But our communications team has also started to work on some media outreach campaigns to younger audiences, both teens as well as college age, with messages about the importance of the impact their decision-making has both on themselves, on their community, but also on the activities that they so much want to have happening.
And this is Jana. Just to reiterate something Dr. Lynfield said a little bit earlier, I think this information about long-term health effects among folks who maybe didn't have terribly severe course of illness or who were healthy before contracting COVID, that's newer information for health professionals and for the public. And certainly the narrative in the early months of the pandemic was, and it is true statistically, that there are groups of people at much higher risk for severe disease and bad outcomes. So that certainly became the story early on, was that for most people this is a relatively mild thing. So as is often the case, as we learn new information, sometimes it's different than what we first thought, and that gives us a job to do, to have to update that messaging and maybe counter a narrative that has built up earlier.
Operator, we have time for one more question.
Thank you. Our next question comes from the line of Hannah Flood with Fox 9. Your line is open.
Hey, my question is, with us getting to that kind of 2.5 or 2 week mark of a lot of students moving into dorms, would you recommend that even those asymptomatic going to college students get tested before they get to campus? And that goes also for when we get closer to high school, elementary, and middle school students. Would you recommend that they get tested?
Well, this is Jan. I think just to reiterate a prior message, the recommendations really have continued to focus on only testing symptomatic people and known close contacts of people who've tested positive. just given the reality of the still the limitations on testing availability and on turnaround time and the likes. So I think just again to reiterate the critical importance of people monitoring their symptoms very closely, taking those preventive actions before coming back to school. And as things might change in the future with development of new kinds of tests, possibly those recommendations would evolve to encourage wider scale testing. But at this point in time, we're continuing to focus in on kind of highest priority testing. But Ruth and Chris, you want to add anything further there?
I'll just reiterate that we are not currently recommending that college students or other, K through 12 students get tested before school starts. So that's not currently one of our recommendations, unless they have symptoms.
All right. Thank you, everyone. That is all the time we have for the call this afternoon. If you had a question we were not able to address, please feel free to reach out to the communications office this afternoon. Have a good day, and we will be back with you again on Friday.
Ladies and gentlemen, this concludes today's conference. Thank you for your participation. You may now disconnect. Everyone have a wonderful day. 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 Everyone have a wonderful day.